cue. So besides popping lips, I always talk about circle lips. I'm very visual, so I just think about what it looks like when I say a sh or ch, a circle, right? So instead of having, trying to get things forward again, and I talk about frontal focus a lot, but I think getting kids to focus on the front of their mouth and also a verbal cue for placement. And I think as that comes forward, they kind of can bring that forward and their tongue and eventually ends up in the right place. But with affricates, so trying to pop it. So instead of a sh, ch, so ch, popping it fast. Since the affricate is a combination of a stop and a fricative. I think for both sibilants and affricates, nose holding can be really effective because it's much harder to direct all that oral airflow. With the p, it's kind of a bigger sound, but to kind of direct that airflow through a smaller constriction, which is what fricatives are all about, and affricates is maybe a little bit harder. And often these kids have habituated a pattern of having it come through their nose. Okay, so again, we don't want to accept it in the back. So our little guy that we watched earlier with compensatory artic, when he did church, was huck, right? It was in the back, so it sounded more like a velar. So we want to bring those things to the front. Okay. So the idea is that we're establishing correct placement in order to eliminate compensatory artic. Okay. So if we have a P and a B that are accurate, then hopefully we do not have that glottal stop anymore if they're saying the P and the B. So establishing placement, eliminating the compensatory articulation is kind of our main goal when it comes to placement therapy. Now our second goal is airflow. Okay. So not only do we have the placement, but we also need some airflow. And the thing is that we can work on placement with or without oral airflow. So if kids are hypernasal, they have a lot of nasal air emission, we can plug a nose and create oral airflow, right? But we can still get placement, okay? And one thing I should say before we move on to oral airflow is there are